Topic 6. Responding to disclosure, supportive practices. First response. Supportive practices for responding to disclosure of sexual violence include: respond calmly. Treat the matter seriously and stay calm. Find a private space to talk as soon as possible. Listen, don't interrupt, don't distract their thoughts, and don't put words in their mouth. Don't panic and make it about your feelings, but do get support for yourself later. Comfort and reassurance. Comfort and reassure the person, but be careful with physical contact, as this could be triggering. Tell the person that you believe them and reassure them that they did the right thing by telling. Make sure the person feels listened to and allow them the time they need to tell you. Allow the person to express their feelings freely and don't impose your own. Don't blame the person for what has happened or do anything to give that impression. Provide information. Provide relevant and understandable information so the person can make choices. Explain confidentiality and limits to confidentiality. Tell the person where you have to report it further. Ask the person what they would like to happen next or now. Tell the person what you are going to do next. And don't make promises you can't keep. Don't agree to keep it a secret or promise that it will never happen again. Understand your role. Check and follow any agency guidelines. Assess the person's safety, both emotional and physical, and respond accordingly. If possible, ensure any critical evidence is not destroyed. Write a factual account of the conversation as soon as possible using the person's words. And remember, it's not your job to investigate. Don't pressure the person into telling you more than they want to. Don't ask probing, leading, or intrusive questions. Use questions like, what happened? What do you mean? Or what happened next? Do not correct or change the person's choice of words during the conversation or in later written documents. Do not warn or confront the alleged abuser. You may be involved in a number of subsequent responses with the person with intellectual disability who has made a disclosure of sexual violence, including making a report to police, going to court, and obtaining financial assistance, advocacy support and counselling. Each of these responses involves specialist knowledge and practice that are beyond the scope of this presentation. However, a brief overview of each will be provided here to give you a basic familiarity with these responses, including some of the key aspects that service providers and support workers should be aware of when supporting people with intellectual disability. Reporting to police. It must be the person's choice if they wish to report to police or not. It is their right to change their mind at any point until the perpetrator is arrested. Support the person to understand the investigation process and timeframes. Recent matters may be done relatively quickly. Historical matters may take several years to investigate and finalise. The person can make an initial complaint at the local police station. It is best to ring the police station first. Let them know about the person's disability and make an appointment. The person can have a support person in the room, but the support person cannot be a witness. The person who first heard the complaint of sexual assault is a witness. The matter may be referred from there to the correct department and a formal statement taken. The person can have a discussion with the police without making a complaint. They can make an official complaint or a statement of no complaint, which means report the assault but ask the police to take no action, or consider online alternative reporting options. Formal statement. Ask for a video known as a 93A interview if possible. This is available to some people with an intellectual impairment, depending on their level of disability. This can make the court process easier on the person and will get a better quality of evidence. Barriers to reporting sexual violence to police. Fear of consequences, lack of knowledge around what constitutes a crime, dependency on abuser, physical barriers to accessing supports and services, poor literacy skills and difficulty completing required paperwork to make a complaint, communication difficulties, loneliness and fear. People may put up with any kind of exploitation from so-called friends and carers. People responding to people with disability based on negative attitudes, myths and stereotypes. Low conviction rates. The court process can be traumatic. Many people will choose not to go through it. Going to court. Support before going to court. Contact the Victim Liaison Officer if appointed, or the police prosecutor or Department of Public Prosecutions and arrange a meeting. Support the person to inform the Victim Liaison Officer or prosecutor of their individual needs. Support the person to tell the prosecutor about the offence in their own words. Support the person to prepare a victim impact statement. Advocate for the person's needs during the court process, if this is possible within your role. Advocate for special witness provisions. If appropriate, offer a court report about the person, their disability, and the crime and the impact of the crime. Find out how the court process unfolds, procedures, timelines, requirements, and dress, so that you can explain this to the victim and help them understand. Visit the court beforehand with the person, or look on the Department of Justice and Attorney General's website for a virtual version. Read through the victim impact statement before going to court. Plan some activities to do while waiting to be called. Do not coach the victim on their statement or story. Support in court. The victim needs a person to support them through the court's process. It's long, arduous, very confusing and frightening. Help the person to know the small steps of the process. Support person can be family, a friend, a worker, but they must not discuss the victim's story with them. You risk them being seen by the court as an unreliable witness. The person who has been charged with an offence may also need a support person. Barriers to justice in the legal system. Barriers to making it to trial. The DPP may make a decision that the victim will not withstand cross-examination. There may be assumptions by police or legal officers about the reliability of the victim as a witness in court, and misperceptions about people with cognitive impairments. Barriers to receiving a fair trial. Special witness provisions are not always made available. The court process is complex, and sometimes communication aids are not allowed in trials. Difficulty with skills and tasks required during legal proceedings. People with intellectual disabilities may have difficulties with recall of events or correct sequencing, which is similar to how trauma affects most people, abstract understanding, suggestibility, concentration during long police interviews and court proceedings, reliance on formal written processes, for example, a letter of when to appear in court. The complex and stressful nature of legal proceedings. There is a greater anxiety and stress for the victim and family and carers. Ongoing trauma from the event and then subsequent trauma through the legal process. And there are low conviction rates in sexual assault matters due to the need to prove guilt beyond a reasonable doubt in court. There are no guarantees. Lack of appropriate support. There is an under-resourcing of specialist services. Financial assistance. A range of financial assistance may be available to victims of crime, including the Centrelink crisis payment, which is the equivalent to 1 week's payment at the usual rate, or an advance payment, which can be up to $1,100 for someone on DSP. Victims of Crime Queensland Financial Assistance. The Queensland Government provides financial assistance to victims of crime and may pay for or reimburse the costs of goods and services needed by the victim to recover from the physical and psychological effects of an act of violence. This financial assistance is designed to be available for victims to help reduce the stress and trauma involved in incidents of violent crime. Applications for financial assistance are made to Victim Assist Queensland and are decided by a government assessor. Medicare. If you are eligible for Medicare or have private health insurance, you may be able to claim back some of your medical or dental expenses resulting from the crime. Workers' compensation. If you have been injured as a result of violence at work, you may be entitled to workers' compensation. You should tell your employer as soon as possible about your injury and see a doctor to get a workers' compensation medical certificate. Advocacy. People with intellectual disability often need advocacy support to ensure they access appropriate and available support and responses in police and court processes. For example, to have a support person present in interviews, to access a Video 93A interview, in service systems, for example, to relocate perpetrators to new accommodation where they are a co-resident with the victim survivor in shared housing situations, and or to access available financial assistance such as crisis and advance payments. Counselling. There is a common belief that people with an intellectual disability are not affected by trauma and would not benefit from counselling. This is not true. However, counselling should be provided by a qualified, experienced counsellor. It is important to note that people who experience traumatic events do not automatically require counselling, and many people recover from trauma with support from family, friends, and community. However, we know people with intellectual disability may lack a supportive relationship. Counselling may be an appropriate response where people demonstrate signs of an intrusive trauma response that is interfering with their quality of life. For example, flashbacks of the event, avoiding reminders of the event, and experiencing ongoing fear, anxiety, and/or emotional distress as a result of the event. The human response to traumatic events will be discussed in more detail in Module 3. Where counselling support is indicated, service providers and support workers can take the following steps to assist a person with intellectual disability to go to counselling. Talk about what counselling is. For example, download the What is Counselling information sheet from the WILD website and look through it with the person. Ask the person if they would like to try counselling. Let them know that counselling is about helping them feel better and to be and feel safe. Let them know they do not have to talk about what happened to them or the trauma. Ask the person if they would like a support person to attend. The person can have someone in the counselling room if they wish, but this is their choice. If you attend counselling as a support person, do not speak for the person in counselling. Don't minimise or contradict the person's story. Remember, the problem is the problem, not the person.
Thank you for completing Topic 6, Responding to Disclosure, Supportive Practices. Please return to the homepage to complete the learning activity, and then you will have finished Module 2, Responding to Disclosure. Module 3 will look at supporting recovery from trauma.